Good afternoon. It is Wednesday and it's noon, so it's time for Let's Talk Hormones. I am Dr. Gail Jackson. I'm board certified in obstetrics and gynecology. I am on staff at Cedars Sinai Medical Center and have been there for quite some time. And I transitioned from traditional obstetrics and gynecology to bioidentical hormone balancing. Why? Because my ladies grew up and needed other things, and I wanted to grow with them. And selfishly, I wanted to have everything I needed to know for myself, and it was my time. So last time we were together, we chatted. We had the the statement is, don't let menopause burn you. So we talked about some of the symptoms of menopause. We talked about some of the non-hormonal methods, medications or supplements to help with some of the symptoms of menopause. And thank you all so much for those questions. One of the main questions I got was, suppose you try the supplements, the black cohosh, the primrose oil, and you really are not getting any relief, and you want some relief. You desperately desire some relief. Well, that's the time to probably start looking into bioidentical hormone balancing. And we use bioidentical hormone balancing in the form of pellets. We would draw your blood to see where we got your levels to, and then we would see what symptoms are really bothering you. Then we can tailor and individually tailor your medication and our formulation to suit you, to get you feeling fabulous. So today we have a wonderful topic. We're going to go back and talk about the Lady Lyft. And as we talk about the Lady Lyft, the question we're going to ask is, how can I look better down there? Immediately I think of the vagina monologue, and I'm sure most of you all have seen it because it's come to town quite a few times. And I remember the moment where the three women were chatting, and the oldest of the three, and I believe she was Jewish descent, she says, "Why are we talking about my down there? I never look at my down there." And the other ladies chatted, especially the younger ones, and sort of talked about how important it is to have a look at your down there. The other day I was at the gym, and one of our clients came up to me and she said, "I listened to you on Facebook. Facebook. I've had 2 children, and I've been married 20 years, and I look so old and funny down there. I mean, everything is drooping, and it just doesn't look healthy and pretty like it used to look. I just never had bothered to look, and I just didn't like what I saw." So ladies, we have the answer for you, and it's a part of the Lady Lift or the O shot. So initially women come in because they are wearing the pee pad, or they're losing urine when they cough or sneeze, or they have the gotta goes, or they gotta dance to the bathroom, or they sing to the bathroom, or hold it, and if the bathroom is not available to them at that time, they may leak. Ladies, we have the answer for you. We use PRP, which stands for platelet-rich plasma, and we use that to support the bladder. It improves bladder support by 80%. So while we're down there, why just stop at the bladder, okay? We look at the labia, the lips of the vagina. The outer lips of the vagina used to be perky and plump and firm and pink. And if you look at them, ladies, if you're menopausal, if you're fortunate enough to be old enough to be menopausal, you're fortunate enough to have had some babies, and you're still in a relationship, and you've had years of sex, you look at the outer labia, and they may look like, they may have drooped. So we also insert PRP, or platelet-rich plasma, in the labia, the outer portion of the vagina, so they can pucker up, so the clitoris won't be so prominent. I have ladies ask me, "What do I do? My clitoris looks so big right now." Well, it's not that your clitoris looks large, it's that the labia that used to cover it like a little flower are now drooped and wilted. So we have PRP to help. And while we're down there, we can also place it inside the vaginal openings to regenerate that tissue. And this is important to you ladies who've ever thought about or considered using laser rejuvenation for the vagina. The FDA has recently decided that lasers should not be used to rejuvenate the bladder. This makes a lot more sense because this is using your cells and the regenerating properties of your cells to regenerate you. How natural is that? Let me talk to you about how we do it. First of all, what is PRP? PRP stands for platelet-rich plasma. It's in your blood. It's the regenerating property of your blood, of your plasma. So we simply draw your blood. we draw your blood, a simple blood stick, like getting a lab test, and we separate off the platelet-rich plasma, which is clear. So don't think we're drawing, inserting red blood cells or anything red in the vagina or in that area. So once we separate the platelet-rich plasma, we can activate it. Once it's activated, it releases all the growth factors, all the regenerating factors, and it can be inserted in just about any part of the body, and it rejuvenates the cells. Sounds miraculous. It is miraculous. Hey Pam, how are you? So good to see you. You're always kind of tuning in. I just wanted to stop and say hi to you today. You're my girl. You're my poster girl. So we use the PRP to regenerate that tissue. So it sounds new to you perhaps, but folks who've had athletic injuries are really familiar with PRP. By the way, that's how that's how Tiger healed his shoulder, and that's how Kobe healed his Achilles and his knee. So they use PRP instead of surgery. And look, Tiger is having his best season yet. So we take that same product, we insert it in the vagina and in the vaginal area, and it rejuvenates the vagina. Simply done in the office, in stirrups, no more pain than just having a blood draw. So not painful at all, no downtime. We ask you to refrain from sex for 48 hours, some of you who can, for 48 hours, just to get the tissue in and keep it in the right place before it starts its regenerating property. But you're up and out of here, no pain, because we use a really good numbing, ample amount of numbing gel on the vagina, and it rejuvenates it. So how do we improve our vaginal health, and how do we look better, and how do we get out down there looking a little better? Well, we use PRP to plump up the labia. How about let's making it pleasure perfect? Ladies, until next week, send me your questions. Give us a call in the office. You have all the information on this site at 310-451-2300, and email us at info@drgailjackson.com, and we have complimentary, meeting-free appointments to just sit down and talk to you about what we can do to help you. When the PRP is coupled with hormone balancing and the estrogen, oh, ladies, you are back in business. Until next week, stay fabulous.